Hi, I'm Elizabeth Leeds. I'm a doctor of physical therapy. I've been working in physical therapy for over 15 years. I work in both the orthopedic as well as in the pelvic floor sectors. In the recent years, my specialty has been in pelvic floor. Because my backgrounds include both orthopedic and personal training and holistic coaching, I have been instrumental in my practice of trying to combine the approach of not just one dimension of pelvic floor therapy, but really integrating it into all aspects of physical therapy, personal training, and holistic lifestyle. As a pelvic floor therapist, a lot of people come to me thinking that they have a weakness in their pelvic floor because they're having urinary incontinence or they're having pain, and it's really not always simple as that. It's a combination approach is usually taken where we look at the pelvic floor in terms of the muscular tightness as well as the weakness, but we really look at the fascial tightness and we look at the entire system. And when it comes to training the pelvic floor, oftentimes we're teaching the person how to relax, how to stretch out the hips, how to stretch out the back. And then from there, we teach the muscles how to activate. Now for people who might be postpartum or people who have more laxity or weakness in that pelvic floor, then we usually start with that education and trying to strengthen the muscles. Irrespective, both parties will eventually go from pelvic floor strengthening and adding in different types of strengthening, not just holding a contraction, but different types of contractions at the pelvic floor, to integrating that into a full body approach. And I think that's where the missing link is and the confusion lies with a lot of the training population, rehab population, is that they think all you do is rehab the pelvic floor, and that's what rehab therapists do with the pelvic floor, and that's not it. We actually get them moving, and then we integrate it as part of the abdominal muscles and the back muscles, and how do they function together with the breath? How do those muscles function with how the hips are moving? Because the hips are an integral part of the pelvic floor activation, or actual connections between the two groups. And then we definitely look at the lumbar spine, because the lumbar spine, the nerves travel in and through the pelvic floor, and oftentimes there's a spinal component. And so whether people come in with back pain or people come in with pelvic issues, there usually something going on between both that we have to address. And then like any other program, you want to take the person from this isolated, here, let's train the pelvic floor, let's get your transverse abdominis going, your back muscles going, have that awareness built, to an integrative type of exercise. And that's where I think the pFIT fits in beautifully, because it's a piece of equipment that can be used both to isolate in terms of having the person feel the mobility of the pelvis and have them get that awareness of the pelvic floor, having their hips and pelvis move in different directions, which can really help relax as well as activate depending upon what your intention is. And that's the other component that I think is a key, is that the pFIT, in with any other exercise, it's a lot of things might look very similar, but what the instructor says to the person is really going to change the intention of the exercise and how it's used. So what I like is that you can teach someone a movement pattern, and once they learn that movement pattern, you then have them do different intentions. Like, I want you to move and really explore the range of motion and just think about relaxing. And then the other component can be, I would like for you to move and now really try to think about the pelvic floor, the back, the belly, and try to control that through that core and use your breath. And that's a nice thing, because you can teach someone like the movement and they're not trying to think about what do I do, where do I go. They actually already know what to do. You're now changing the intention, and I think that can make progress a lot faster.